Good.
Recording now.
All right, excellent. Hi, everyone. I know we had a pretty long guest list for this one, so people might filter in the next minute or so. So for folks who don't know me, my name is Emily Bovier, and I'm in the psychology department. I'm also chair of the psychology department. And at our last leadership meeting, we had the opportunity to talk about compassion fatigue, secondary trauma, and burnout in college professionals. And so I'm not sure if Amy Bidwell and Stephanie Pritchard can make it here today, but they are launching an initiative to get feedback from faculty on how to improve their wellness, especially in light of the last few years and the stress that we've all been dealing with the pandemic. And so in response to this, I teach a course that is related to compassion fatigue, burnout, and secondary traumatic stress. That course is mainly geared towards undergraduate and graduate students who are going to be in the helping profession, mainly clinicians who are working with patients who might have a trauma history. But this is all very relevant to all of us, especially, depending on the nature of our jobs and working with students, we might all be vulnerable to compassion fatigue, burnout, and secondary traumatic stress. So I'm going to share my screen, and I will say that just in preparation for this talk, I think 2 days ago, I received a newsletter from the American Psychological Association that described anticipated trends for 2023. And one of the trends that they anticipated was that faculty would be leaving academia, in part because of things like burnout and stress. So when I'm finished today, I'll put these links in the chat, but here's the article that talks about this projected trend. But what I want to emphasize is that there are ways to help quell burnout. So we can really focus on intervention strategies and prevention strategies to help people who are experiencing this. Some of these terms might be very new to folks. They might not realize that this is what they are experiencing. So I'll share this article with you, and it goes into a little bit more detail than what we'll be able to cover today, but at least you'll have this link. So in terms of what I am going to talk about today, a lot of this information is going to come from a workbook that I use with my students. I'm not sure if, is everything being hidden by my Zoom screen now? Okay, excellent. So, okay, excellent. So this workbook is a resilience workbook that I use with my students. And after considering how it could be useful for all of us at SUNY Oswego, I think there are a lot of really great resources in it. So in general, I'll just start off by talking to you about basic terminology in case folks aren't necessarily familiar with these concepts yet. But compassion fatigue and burnout can oftentimes be conflated, but they are a little bit different. So with compassion fatigue, this is when a helping professional, and we can consider ourselves helping professionals in working with students, you can experience exhaustion or dysfunction. And this can manifest in many domains. It can be biological or physical. It can be psychological, or it can manifest in your social life where you experience exhaustion or dysfunction. And this is because of prolonged exposure to what's called compassion stress, right? So we care about our jobs, we care about our students, and we can experience compassion stress, which ultimately leads to this fatigue. In the literature with regard to helping professionals who work with patients with a trauma history, compassion fatigue is usually characterized as a rapid onset of symptoms. Whereas with burnout, again, in that literature, it's more of a gradual onset and also accompanied by a loss of love for your job, right? So that's the main distinction in that literature from compassion fatigue and burnout. And later I will share with you a self-assessment tool, and you'll see in that self-assessment tool that it sort of merges these two together and just characterizes it as burnout. In addition to burnout and compassion fatigue, we also have what's called secondary traumatic stress or vicarious trauma. And this is where someone could have psychosocial or emotional complications that are related to indirect exposure to trauma through others. So one classic example is just repeatedly hearing traumatic stories. And you can see how it's very relevant to clinicians, but if you think about how this could be relevant to what we are all experiencing as faculty and staff on campus in working with students, particularly, and other colleagues as well, particularly in light of the pandemic and the added stressors that we all have with regard to that. We may all be uniquely vulnerable to secondary traumatic stress. And then finally, it's also really important to talk about the resiliency factors, right? So in addition to compassion fatigue, we also have compassion satisfaction. And another term related to this is vicarious resilience, where we have pleasure derived from being able to do our work well, or we develop resiliency in working through trauma. So this workbook that I've used with my students and that I recommended to Amy and Stephanie as a great resource to use when looking on how to help faculty with their wellness. This workbook has tons of information. So the main factors that this workbook looks at, it has a lot of reflection activities that are designed to help you identify risk factors for burnout or secondary traumatic stress. This goes through things like identifying your own internal and external stressors. It adheres to a cognitive behavioral model. So it helps people identify cognitive distortions that they might have. So if you look at the figure on this slide, this is a model for how to help people understand what they might be experiencing, identifying triggers, identifying any background stressors. We all have individual differences in our background stressors. Any sort of cognitive distortions or negative beliefs that we might hold. And the workbook has an extensive list and examples of what these may be, how it contributes to negative automatic thoughts and emotional and behavioral consequences. And you'll see that this sort of leads to a feedback loop, these negative thoughts, emotional and behavioral consequences. So this workbook has a lot of reflection-based activities to help you identify your own personal experiences that might lead to risk factors. And then it also helps you evaluate the degree of organizational support that you have. And so we know that a big contributor to things like burnout include the degree to which we have organizational support. Their workbook also has self-assessment tools. I'll give you an example of one. I'll send you a link that you can all use to self-assess today. It's called the Professional Quality of Life Scale. And then the workbook also has guidelines for intervention. And this includes things like helping people understand where they are in terms of their motivation to change. Are you in a pre-contemplation stage? Are you in a contemplation stage? Or are you ready to take action? And it helps people develop a self-care plan. And I recognize that the term self-care in society as of late has become very kitschy, but this workbook is talking about empirical-based research that helps you develop a true self-care plan to help prevent things like compassion fatigue, burnout, and secondary trauma. So we're talking about it in the context of this clinical psychology-based literature. All right, so the Professional Quality of Life Scale, which is going to be the thing that I'm going to share with you today, there's different perspectives for how to use it. And so in using it for your individual or personal use, just keep in mind that it's meant as a screening tool. It's not meant to be a diagnostic tool, but it can help plan where to devote your energy to help you increase resilience and self-care. From an organizational standpoint or supervision standpoint, it helps with understanding where people are at to maximize positive aspects, reduce negative aspects of, and this is couched as the helping profession, right? But you could think about our work here at the college. And then in terms of if we wanted to use it in a supervisor role of some way, this screening tool could be useful for helping people with colleagues and their supervisors in some capacity. All right, so I am going to show you what the Professional Quality of Life Scale looks like. And I'll also put a link to this in the chat so that you have access to this. So the Professional Quality of Life Scale, and here's a great way to just see what are some of the signs and symptoms of something like compassion fatigue or burnout or secondary traumatic stress. So it's a Likert scale. You just rate the degree to which you identify with these statements. And you'll see that in parentheses, it has help because this is meant for the helping profession. I've also done a talk related to this for Title IX employees. And so they can sort of just consider these questions through their professional lens. So you can look at this through your own professional experience and rate yourself on these items. So you'll see how these items target different components of where we might be experiencing stress, whether it's our thought processes, our interpersonal relationships, physiological responses like sleep behavior, eating behavior, and things like that. So I know this is a really short presentation, but the main goal with this is to just be informational and sort of open up the doors to having a conversation about these things and giving people some tools to help them on this process. So for right now, I'm going to stop sharing my screen and I will put in the chat that link to the professional quality of life scale. So all you have to do for the professional quality of life scale in the link that I send you is just scroll down to the English self-scoring version, and you'll be able to download a PDF and it will walk you through how to score yourself. And you'll get a sense as to where you stand for compassion satisfaction, burnout, and secondary traumatic stress. So it can be a really useful screening tool, not diagnostic, because I understand, secondary traumatic stress can be conflated with post-traumatic stress disorder. We're not working towards diagnostics. We're just looking at self-monitoring, if you will. Okay. Does anyone have any questions or comments at this point or reactions to this type of information? No, just here to absorb it and take it all in. Okay, that's wonderful. I'm glad that folks came. I see a question in the chat. So when you scroll down on that main page, you'll see that there's an opportunity for you to take this screener through their website. Just scroll past that and you'll see there's PDFs for different versions, and you'll want the self-scoring version. And that will give you all of those items. And then it also gives you how to score them. Any other questions or comments? Or suggestions that you might have as to how we might be able to make use of this if we wanted to convey some more feedback to Amy and Stephanie, who are sort of launching that initiative to help with faculty wellness.
This is something that perhaps other people are not interested in, so maybe you can just tell me privately, but are there norms for this particular measure?
So I have not seen any data with respect to college professionals, but you'll see that on the screener itself, because it is meant to be just an independent screener, it will give you cutoffs as to where you generally fall with respect to these. But I have not looked at any specific data for, faculty and staff on a college as to what scores would typically look like for that particular population. So, and I imagine, the workbook gives data with respect to clinicians, medical personnel, but they don't have data related to college folks. A good question. Any other questions or comments?
I would imagine that your score might differ depending on when you take it. So do you have any suggestions about that?
I think with regard to that, that is where, and alongside of that, the workbook will help you with that reflection process of seeing, okay, do my scores stay the same? Are my scores elevated at the beginning or the end of a semester? So it's more of a tool for coupling, having that like tangible item score can be really helpful for some people. And then you can reflect back and see, what have been my triggers? Why has this score changed? And then it gives suggestions for interventions or ways to develop a self-care plan, which you can then implement and then perhaps see if that trend changes, right? So if you notice a trend throughout the course of a semester or the course of an academic year or the course of a career, right? If you think about junior faculty compared to senior faculty who likely have different stressors, but they might have the same scores, right? So it's very individualized. And so it will just help you sort of start that self-reflection process. That's a great question.
And if I can follow up with that, are they planning on connecting this with our EAP program?
I have no clue. Kristen, do you have any insight on that? Looking for the mute button. Spacebar? Yeah.
Not this particular measure that I'm aware of, but of course, anyone could suggest that. But yes, but connecting the EAP initiatives with the campus wellness initiatives, definitely. And the EAP committee, for those of you who know about it, has been recently reactivated, and it has some really great members and some good ideas. And if you want to talk to somebody, Jen Cook is on that committee.
Sorry, what's the EAP committee?
The EAP is the Employee Assistance Program.
Oh,
Every
right. Okay, sorry.
campus has one, but not every campus has a committee that has like stuff they do. So
All right. Any other questions? And you can always feel free to reach out and email me afterwards as well if you'd like. Anyone in the room, Maggie? Questions, comments?
Anyone?
All right.
No,
Well,
I think
thank
we're
you so
good.
much for
Thank
coming.
you. Yeah, thank you so much.
Thanks a lot.
Thanks for sharing the resource, Emily. It's really appreciated.
Absolutely. Thank you.